Hi, Lina. Good morning. Thank you for jumping into this coffee chat with me.
Good morning, Val. Thank you for having me for the coffee chat. I've been looking forward to it. This is a
Yeah,
really famous topic lately, so I'm excited to dive deep.
very good. Well, I know that National Locum Tenens Week is around the corner next week, in fact. And
Yes.
as an organization, we are going to do a lot to celebrate the physicians and the advanced practice providers that we support and work with every day. When I think about locum tenens and the providers, I know how much flexibility and expertise that they bring to healthcare, and we hear from our clients continuously that they are, taking care of patients and providing that continuity of care where and when it matters most. So we know this week is dedicated to them, but we also recognize that their impact extends far beyond just one week. So thank you for being here to help us celebrate. Uh, Today, I have some questions prepared for you. I want to talk about why locums are an important part of healthcare and specifically how their role has evolved over the years. And then we want to be able to convey the importance of that to healthcare organizations and the providers themselves. So thanks again for joining me. And my role for our audience, my role is Vice President of Healthcare at Medix. I very recently hit 20 years with the organization. I'm so proud of that. And I have spent my time here partnering with organizations to solve their workforce challenges through staffing and recruiting across the healthcare continuum. I'm here to chat with you today because I have been heavily involved in recently expanding Medix's staffing services to include locum tenens. We have a long history of placing providers with our clients, but we have more recently extended that to the formal locum tenens assignment. So I'm very excited to learn from you because of your 30 plus years of expertise in this field. So tell us a little bit about yourself, Lina.
Great. Thank you, Val. I have spent over 35 years in the workforce management space, more recently in the healthcare space, putting locums to work at my previous organization. I'm working with you all now as the healthcare consultant and really launching and building what we're doing at Medix, which is all wonderful things in the locum space. I'm excited to talk to you about that, and congrats to you for 20 years at Medix. It's a great accomplishment.
Thank you. It's been a wild ride.
Yes.
I'm lucky to say it does not feel like 20 years. Okay, so let's jump in to the topic of locum tenens and just the definition of locum tenens. When people hear locum tenens, I know they think of a temporary staffing solution. You've been on the sidelines and in the game over the years, watching how this industry has evolved. So how would you describe the role that locums play in healthcare today?
And it has evolved over the years, because it did start out as temporary work. The word locum really, it did, and the function of a locum was supporting doctors that were going on sabbatical or taking a leave or going to a conference, and they wanted to continue the continuity of care with their patients without having, and the revenue stream too, without having to shut down their facility for their sabbaticals or their leaves or their conferences, that sort of thing. So it really was a short-term fix to, a doctor's problem. And it's evolved over the years to become really now a core workforce infrastructure. It is embedded in how inpatient and outpatient facilities really staff their facilities and how they function. And I think without the concept of locum, you really wouldn't have healthcare facilities operating at the speed and the level that they're operating right now today. The idea of utilizing a flexible staffing model and using providers as flexible staffing allows the facilities to manage their volume as it ekes up, comes down, depending on where they live. You've got situational, spikes and valleys, vacation times, seasonal areas. You also have testing new service lines. That wasn't, what you use locums for initially. Like, oh, I'm testing a new service line. I'm opening a new service line, and it takes longer now to hire a permanent person, so permanent providers. I'm going to start with locums. There are a lot of ways clients are now utilizing locums from a workforce management. It offsets physician burnout for their current team while they're looking for permanent staff, and it's not just an emergency fix anymore. It really is an embedded solution in a lot of our clients. And if they use it right, it is an embedded solution. It helps them continue the patient care, which is number one. Number two, continues the revenue stream.
Got it. Okay. So no longer a response to an emergency situation. Sounds like organizations perhaps might be now reliant on it because they need that flexibility, and it is a long-term plan versus a reactive plan. Thank you for those details. We learned, based on your explanation, how locum tenens has evolved on the facility side or the organization side and how they utilize locum tenens. I'm curious to know if you could tell us about how the profile of a provider, a locum tenens provider, has changed alongside how the facility utilizes them.
Yeah, that's a really good question, because the profile has changed over the years. It used to be someone who was going into a retirement stage of life, or kind of like slowing down a little bit, didn't want to work the hours and wanted a little bit more control and some flexibility and some time off, but still wanted to work and see patients. So, with that model, you can slow things down a little bit, come out of working for the big hospital and work as a locum. Choose the facility you're going to work for, choose the hours, really have control over your schedule, choose the location. Maybe you want to do it, I'm in the Boston area. Maybe you want to do it in Florida half the year and then back in Boston half the year, that kind of thing. So you can, or your son or daughter are going to be in college in Arizona where you are, Val. I'm going to go out there and work out there. So it's become more of a lifestyle, not just a retirement thing or a slowdown. And I'll tell you a story about one of my cousins. Her husband started as a locum right out of school, which some people do. That is one of the models. Coming out of school, you start as locum, you learn all the different facilities. You work in a research facility, you work in an Indian health reservation, you work with different patient populations, and you kind of get your bearing around where and what you want to do. And then maybe you settle down and you might work 30 plus years, in one local area, and then decide to be a locum later, which is what my cousin did. He started as a locum, started his own practice, and then closed the practice. And now he's working as a locum and kind of traveling, and his wife travels with him too, that's like the traditional model. Mm-hmm. Now you're finding more APPs coming into the mix. A lot of the nurses have taken their additional training and getting into the nurse practitioner model. And so as you're doing that, and some of them have work-life balance situations, working as a locum gives you what's that contract. That contract that gives you fixed hours, that says, well, no, this is your schedule, and you don't need to work anything more than this. These are your days. These are your shifts. Versus if you were perm, you would have to stay on, maybe take on an extra surgery or work an extra day or work an extra night. Working as a locum controls your work-life balance. And that's a big driver now for folks, especially after COVID, is having a little bit more control in their life around their hours and just taking care of their family and working in where and when they choose to work versus being mandated by the facility. So you have the bookends coming out of school and kind of retirement, and then you have everybody else that's starting to do it more and more now because it controls their schedule and creates more of a work-life balance. There's a choice now of how you can work.
That makes sense. Okay, thank you. Speaking of the profile of a locum tenens and how that has evolved, next week is all about celebrating those providers that impact healthcare through being a locum tenens. If you had to put into words, understanding that profile and some of the things that you mentioned motivates a locum tenens to take those assignments. What would you say you admire most about those physicians and APPs that will take on a locum tenens assignment to support a facility?
I admire their flexibility. I really do. Their flexibility, their adaptability, they're coming into a new environment, they're meeting new people, like new peers that they're going to be working with in a new facility with a patient population that they're not familiar with, but they're getting to the read everything and get comfortable with that pretty quickly. Their adaptability, their flexibility, and then they can solve the problems. That's why they're there. So love that mission critical. To me, it feels like they're the sniper landing in the hospital and like ready to go, right? And they're taking care of the patients. And I love that about them because they really keep the schedule going and it allows the hospital to continue scheduling and seeing patients.
Wonderful. Okay. So flexibility, adaptability, problem solving. I love the term mission critical because they are so critical to healthcare today. It seems like you laid out what might make the most successful locum tenens. Are there any other characteristics that you would advise a facility to look out for, or even a recruiter? What characteristics make a successful locum tenens today?
In addition to having more control and wanting more control over their schedule, because that is the big driver right now, it's really wanting to work with patients in different locations. That I think is important. Like you're not set on the one facility that you may have worked in the last 5, 10, 15, 20 years. You want variety. You want to treat different patient populations. You might want to speak a couple of different languages. If you've never worked inner city, you work inner city. If you've never worked rural, you work rural. I think it's that creativity and ingenuity of doing something a little out of the box for them, but continue the patient care. And that's the number one thing that they want to do is continue the patient care in different settings with control over their schedule choice.
Great. Variety. That's a word that I took away from what you just explained. Thank you. Clearly, based on how the locum tenens opportunity has evolved over the years, it can be an incredibly rewarding career, not just a moment in someone's career, but actually building a career on that variety and that control that they have. Equally on the facility side or the healthcare organization side, it is increasingly important to have locum tenens as part of your workforce strategy. It's important because we know that healthcare organizations are faced with so many challenges, workforce challenges, and those continue to grow as we experience events like the aging population. So can you reiterate, I know you mentioned some of how the usage of locum tenens has evolved over the years from just traditional emergency response. Can you reiterate or explain again what you see out there in healthcare that's driving the demand and the need for that locum tenens strategy?
The types of facilities that are using locums has expanded. It's initially, like I said, it started with sabbatical leaves and that sort of thing. So it might have been a family practice to keep their, facility open, continue the revenue, see the patients. The types of facilities and where we're seeing patients has changed. It's a lot of inpatient, equally outpatient. And then you have the home, and then you have telehealth. And if you think about all these newer avenues that are opening up to see patients, that demand continues to go and grow as there's physician shortage going on and more pressure on the permanent providers to, take on the shifts, do more things during the day, take that extra surgery, work the weekends, that sort of thing. So you not only have different outputs of patient care, inpatient, outpatient, surgery centers, urgent cares. I mean, you see urgent cares in every strip mall. You've got telehealth attached to just about every hospital plan as part of the ways that they continue to see patients without having them drive back into the facility. You have doctors at home. You have private pay. I mean, if you think about all these things that didn't exist not even 5 years ago, seeing a therapist on telehealth. People never talked about seeing a therapist before. That was a secret about, talking to my therapist. Now it's not a secret, right? And you can go in a conference room or go to your car or go to a private office and have your therapy session and then come back to work. So there are so many things that have opened it up. And as as these things have opened up, so has the schedule. And as the schedule opens up, so have the voids. And as the voids open up, there's that need. So how do you take care of those needs? You have to hire. And where do you hire? Well, you got to bring on your locums to continue with the patient care, the continuity, and all of the new outputs of service that we provide now for our patients. In addition to that, we do have an aging society. More of the country is 55 and older. And as we age in that 55 and older category, we're seeing more providers. We don't have one visit a year. We might have one visit a month. We might have one visit a week. We might have one image a month. All these things, more surgeries, knees, right shoulder, left knee, left shoulder, replacements. Your orthopedics have gone up. Your surgeries have gone up. So as people age, which our population is, they put more stress on the facilities. And those facilities are seeing more appointments. And to handle those appointments, you have to have providers there to take the appointments. And where are you going to get the providers? You need the locums to be part of your workforce to be able to solution and take care of the patients and not create leakage where they're going to other facilities because they have to wait longer to be seen, right? And creating leakage is actually losing revenue because doctors provide the revenue for the facility. So it really is a full circle of where we are in life, and there's a solution. So you want to take advantage of that solution and embed it in how you plan the hospital scheduling, recruiting, retention, and brand.
Okay.
Brand.
Yeah. So what I hear from you is the wonderful thing for healthcare is that access is expanding and new care settings are emerging, and with the aging population, that is creating just a whole new level of demand and voids that need to be filled by providers.
Exactly. And, you have more states now that have taken on Medicare, Medicaid, so access to healthcare has increased across the country. With that said, more appointments are coming in. All of that puts a strain and pressure on the healthcare facilities to see patients. And to see patients, which is the reason for being, they need to be able to staff accordingly. And to staff accordingly, you really have to be smart about a full workforce solution.
Mm-hmm. And when I think about where a locum tenens strategy could really bring value, I do think about rural communities. And especially with the Rural Health Transformation Fund, I'm curious to get your thoughts on how rural communities are being impacted, by these workforce challenges and how the locum tenens workforce strategy could bring solutions or could positively impact those needs.
Yeah, rural communities are, in a bit of a stuck, right? Because of their locations, their proximity outside of a city, they more than likely don't have a medical facility near them that's a feeder facility to, bring doctors or APPs to their facility because of their proximity. And then you have a seasonality many times in rural facilities where it could be a vacation place. And so they get extra there's more patients coming in. They get the surge because of the seasonality based on the location. So it's not just that they're rural. That's one piece of it. Then you get the surge depending on where they are. Like where I am, Cape Cod would get a surge. The White Mountains would get a surge. That kind of thing. It's all seasonal. And around those surge time frames, how are you going to take care of the concussions and the boating accidents and, that sort of thing, right? So you have to think about not just their location, but their patients. And do they have the facility to be able to support all the needs of that local community? And sometimes they don't. And sometimes patients have to because they don't have the staff. Patients have to drive hours to get to a hospital to take care of their needs, whether it's eye surgery or cancer treatments or anything along those lines. Having a provider be able to work out there for 6 months, and some of them do sign on for 6 months, some sign on for 3 months, some sign on for 6 months, and having that continuity of care allows that local community to continue with their, whether it's their cancer center or their OBGYN or whatever the specialty might be. that's important for that local community because many of them don't have access to get to a big city to, to take care of things.
Mhm.
So locums do fill a big hole for that reason.
That makes a lot of sense. And I imagine uh, preventing that leakage of revenue that you mentioned is really critical for rural facilities as well. So
Keeps them open. Many times that's what they have. We've worked with some facilities where almost, not everybody, but almost all the physicians in the facility were locums because of where they're located. And it's a mix of MD and APP in there, which is fine too. But again, you need to keep your local population able to be seen, and I think that's an important thing. Closing down makes it hard for the people. They have to go drive many miles. It's difficult.
You mentioned rural facilities that understand that they have to rely on locums, some of which use purely locums because of their scenario. Is there anything else that comes to mind if you look back at some of the most successful healthcare organizations and how they use locums? Anything else that comes to mind that other facilities might be overlooking in how best to utilize a locum tenens?
Yeah, I want to say the top healthcare facilities treat locums not as a temporary asset. This is not just a temp coming in for the short term until we find somebody on the long term. They really look at locums as a full workforce solution. They could be taking shifts during the day, shifts at night, shifts weekends, call, like where are my holes and how do I fix them? So I'm looking for direct hire. I might need contract to hire. I might need locum. I might need a per diem. I might need telehealth. How do I staff my facility, keep the revenue flowing, continue to see my patients, grow my business? How do I do that effectively? Well, you do the clients that understand the full workforce solution model are the clients that embed locum in their staffing philosophy. And you can see it in their scheduling process because they go out 5, 6, 7 months in the year, if not the whole year, and understand where and how to fill those voids along the way.
Wow.
It's a solution.
Okay. And you mentioned the first thing that you said is the most successful facilities treat them as a permanent part of their workforce strategy, as an established part of their workforce strategy. What would you advise or what would you recommend to organizations? How do they build stronger and better relationships with their locums so that they can continue to utilize locum tenens as an established workforce strategy?
A staffing organization or
I would say the providers themselves, the locums themselves. How would a facility treat them or work with them to build like a stronger partnership with them?
I'd say when you think about the recruiting teams that you work with, your advisors really need to know your life circumstances and what you're looking to get out of your position, your career, your work-life balance, really understand your family situation, what you want to do, when you want to do it, like what makes you tick and what makes you happy and what environment will that be. And working with your advisor on that will find the right solution because your situation will change over time, right? Your needs for different things change over time. So maybe sometimes you want to work direct hire and sometimes you want to work locum. And what's the right situation for you? So really being as transparent as possible with your recruiting advisor about your life circumstances and having them understand what you're looking for. And then they will find that. There's plenty of opportunity out there. We have a lot of clients that are looking for excellent locums to work for them and to fill those voids. There's not a shortage of openings.
Good advice for organizations. And that's a good segue. If we were to ask you, if your goal was to build an ideal experience for the healthcare organization and the locum tenens provider, I imagine there's a place and a need for staffing partners to step in and help bridge that relationship and provide the locum tenens solution for that facility and on behalf of the provider. And so what would you advise, or how could a staffing partner be the best support system for that healthcare organization? How would you advise that staffing partner to create a better experience for the organization and the locum tenens?
So the best way to look at supporting a client and partnering with them is to take a look at the full benefit of being staffed. The full benefit of being staffed means it's not just a transactional model of filling a shift or filling a spot, but really understanding the workforce solution and their culture around being staffed, their culture around who their ICP is as well, like their type of provider that does the best in their facility. What are they looking for? And so understanding the profile of what they need for direct hire, contract to hire, locum, your long-term and your short-term needs as a partner is very important, because different things change, right? Your scheduling cycles have shifts. They go up, they go down, they go sideways. You have a new facility, you have a different location, you have new, surgery centers or psych facilities opening up. So different things happen at different times. It can't be transactional. It's really understanding the full effect of your talent and what you're looking to do to run your hospital or your outpatient facility. And understanding that as a partner will help us build a solution. And in that model, we'll have what works for you, a combination of a direct hire, contract to hire, a locum model. And that would be the plan. And of course, things shift and change, through that plan as well. I mean, we always want to make sure we have a good cultural match. So that's why I bring back, what is the right profile, because every location is different and you want a good cultural match. But you have an ecosystem. And we need to understand your ecosystem so that we have the right candidates for you. Again, both short-term and long-term. It's not transactional. It's a partner and it's a process.
I hear more variety, not just one solution for every healthcare facility, but being able to be a true partner, understand their workforce needs, and offering that variety of solutions.
And it's like an elastic. It changes, it stretches out. It's harder, and then sometimes it's easier.
Mm-hmm. We've heard you talk about what a healthcare organization can do to build the strongest relationships with their locum tenens providers. And you've just talked us through how a staffing partner can be the best support for a healthcare organization. Taking all of that, how can a healthcare organization approach choosing a locum staffing partner? What are some expectations they should hold that partner to, or what advice would you give them?
I think they have to ask a lot of questions and really understand the locum staffing partner that they're working with in terms of their capabilities and where and how they can support them. So again, it's not transactional. It's what do we do? How is the credentialing process? What is the rigor around that? What does the interview process look like? What's the rigor around that? How are you learning my business, my ecosystem, and my clients internally? There's a honest relationship there and a trust that needs to be built so that we learn each other. What does Medix offer? What does the client need? What are the client needs, and how do we work together to make that happen? The less it is around a transaction and the more it is around a partnership and a solution, we get there faster and we get there better and we get there together.
We get there together. Very good. Okay, so switching to next week being all about celebrating the providers themselves. If we have any physicians or APPs out there that are watching this coffee chat and maybe they are considering a travel assignment for the first time or entering into the life of a locum, what advice would you give them as they consider making this change or stepping into that lifestyle?
I'd say talk to some folks. I mean, almost every provider out there works with a locum right now. So talking to the locum about, tell me a little bit about your schedule. How are you controlling your schedule? Tell me a little bit about this gig. Tell me a little bit about your recruiting firm and who is your recruiter and how do they work with you and how often do you talk to your recruiter? What does your recruiter know about you? Learn the lifestyle and kind of embed yourself in it and say, why would I want to do this? Do I want to do it for control? Do I want to do it for flexibility? Do I want to do it for travel? Do I want to do it, for money? There are so many reasons why people want to do locum, but really kind of interview the people that you work with too. And like I said, just about every provider out there works with locums because all facilities use them for the most part. So ask a lot of questions like you would, to anybody that you're trying to understand. And if it really does tug you and say, I want to give it a shot, then work with us. We'll work with you on putting you to work. We have a lot of wonderful clients nationwide. We have lots of opportunities and different end client opportunities, whether it's an inpatient, outpatient, a research facility, an Indian health reservation, you name it. We have a lot of opportunities that we can put in front of you and we can help you decide what's the right client for you based on what we have. And things change, we get new openings all the time. So I think talking to other locums and then talking to a recruiter with us here at Medix to really understand what is a day in a life and how does it work and, what does my credentialing look like and that sort of thing. Do your homework and then make that decision. And I think you'll find
that resource, don't we?
Yeah, we want to be a resource for you. Yeah, your recruiter will walk you through it all.
Great. Okay, as we wrap up, I want you to pull out your crystal ball, Lina.
Okay.
And when we think about the future of healthcare, I mean, who knows what it holds, this wild west of healthcare. But when we think about the next 5 to 10 years, what do you think the role of locum tenens plays? Does it continue to evolve and in what way?
I've been in staffing for so many years, temp staffing mostly. And when I started in temp staffing, it wasn't even 1% of the workforce. And that percentage has just continued to grow and grow and grow. When people think about locums, they initially thought, well, it's just a temp that's going to be here for a day while my doctor's out, that kind of thing. Over the years, locum, in 10 years from now, and 20 years from now, it is embedded in the workforce. That is my crystal ball. It is expected that healthcare facilities are going to need them to, to run their facilities and help them run their facilities because you can't meet the demands of the patients with what we're talking about, the aging population, multiple facilities opening up. You've got, surgery centers outside, not just inside, so people can choose where to go and have surgeries, for example. They can choose if they want telehealth or if they want to be, in the hospital talking to their doctor, their provider. So you've got all these things tugging at you, which are going to continue to happen. And you're going to continue to have the shortages, and there's 3 positions for every 1 provider. It has to be that it's an embedded, integral piece of how you run your operation. It is so tightly woven into workforce management. It is right there. It is how you run the facility and see your patients. And that's how I see it with my crystal ball. That is absolutely a piece of the business.
Okay. Well, if I had to, I've been listening to everything you're saying from the perspective of the facility and the provider. And if I had to pick one word that would sum up the relationship between the facility and the provider when it comes to locums, I'm pulling out flexibility. Organizations need flexibility to meet the demand, and then providers more and more desire the flexibility over their career and their lifestyle, as you mentioned. Is there a phrase or a word that you would pick that represents our conversation today?
Yeah, I'd say for the facility, it's operational agility and patient access. Those. Right. So operational agility allows you to, be able to be staffed as you're opening up new service lines, creating service lines, growing your business, that sort of thing, which hospitals do to continue to go and grow. And patient access as you're doing that, being able to open up the provider panel once our contract is signed. the contracts are signed on both sides, the facility opens up the panel, and now we can start scheduling patients. So until that contract is signed, we don't have the patients being scheduled for that block. So operational agility, I think, is number one, and number two is patient access.
Makes a lot of sense. It's important. Thank you, Lina, for your time today. I know your valuable insight will be helpful to organizations and providers, to anyone watching our coffee chat or reading about our coffee chat. So thank you for spending time with me. And I know that at Medix, we will plan to do a lot of celebration and recognition of locum tenens next week and the facilities that provide a wonderful work setting for them. And I know you'll be partnering with us to do that. So
absolutely, I'm looking forward to
today.
Big week. Thank you for having me, and I'm looking forward to next week too. Celebrating our locums.